Okay, good evening. This is Brother Wolf, and this is HS 375. Tonight we're going to be talking about rehabilitation facilities, and I'm going to turn it over to the group. Whenever you're ready, feel free to start.
All right, here we go. So the basic definition of a rehabilitation facility is a facility licensed under state laws to provide skilled nursing care and intensive rehabilitative services. Patients go here to work on their strength after different medical conditions and also following like acute medical issues that they have.
Okay, so the next thing we wanted to talk about rehabilitation facilities that make it different than the acute hospitals or long-term care facilities. The first one that I found was that there's a higher level of care. When it comes to rehabilitation, often illness or injury, acute care rehabilitation hospitals hold a clear advantage over other settings. Research clearly shows that outcomes are better and recovery is faster in acute care setting compared to skilled nursing and nursing home care. IRF provides such a high level of intensive therapy as well as specialized nursing and physician care. The next one I found was the improvements in technology allow care to be provided outside of hospital setting. The payment policy encourages reductions in inpatient hospital care. Some conditions cannot be successfully cured all at once, therefore rehabs help patients with their final stages of recovery. They also help prevent further deterioration in health status and restore functioning. And the last one I found is they maximize quality of life for those with fatal illnesses. Next screen, please. The next thing, we wanted to describe the components of an inpatient rehabilitation facility. The first thing I wanted to talk about is what is an inpatient rehabilitation facility. These are hospitals that provide intensive rehab services to patients after an injury, illness, or surgery. Next thing I want to talk about who provides the services in these facilities. There's physical therapy, occupational therapy, respiratory therapy, speech language therapy, rehabilitation services, and prosthetic devices. The last component I want to talk about is the Medicare patients and Medicare payments. The largest portion of next slide, I'm sorry. I'm just reading off my notes. The largest portion of reimbursement is from Medicare. Medicare pays up to 100 days of acute care or rehabilitation services per acute care incident for the elderly. And I also wanted to include some numbers showing that how it's gone up over the years. And that's it. Next slide.
Okay. The components of a comprehensive outpatient rehabilitation facility, or CORF, is a medical facility that provides outpatient, diagnostic, therapeutic, and restorative services for rehabilitation of injury, disability, or sickness. This care is commonly known as outpatient rehabilitation care. At the very least, a CORF must provide the services of facility doctors, physical therapy, and social or psychological services. In order to get services at a CORF, a doctor must, his patient must come in and a plan of care will be decided between the doctor and the patient, and then that plan of care will also be revisited after 60 days of services at a CORF. Some of the covered items and services of a CORF include a doctor service, physical, occupational, respiratory therapy, and speech-language pathology services, prosthetic and orthotic devices, including testing, fitting, and training in the use of these devices, social and psychological services if they relate to and are needed to carry out the rehabilitation treatment, And also nursing care is provided by or under the supervision of a registered professional nurse. Next slide, please. So the following conditions apply to have CORFs they have to meet certain regulations and provide certain services. And these include, they must provide 3 core services: physician service, physical therapy, and social or psychological services. They must also provide optional rehabilitative and other medically necessary items and services. They also, like the previous slides, they have physical therapy, occupational therapy, speech language, pathology, and they also work with doctors to define plan of cares or POCs for treatment of the patients who are receiving them in the facility. Certification is required for coverage and payment of a therapy claim. The core physician or the referring physician must complete a timely initial certification of the plan of care within 30 days of completion. The physician must review and recertify the plan of care during the duration of the plan of care or within 90 days, whichever is less. The core claims must contain the national provider identification for the provider and of the certifying physician identified for either the physical therapy, occupational therapy, or the speech language services that they are rendering at the facility. And then also functional reporting is also required, and this is the beneficiary's functional limitations reported on claims must be consistent with the functional limitations identified as part of the therapy plan of care and expressed as part of the patient's long-term goals. So basically, when a patient comes in, the doctor must complete a plan of care for 30 days and then revisit that plan of care with the patient before the 30 days is ended to make sure that the patient either is being requalified for services or having another plan of care and a different another plan of care designed for the patient. Next slide, please. Okay, the next question that we had was, can a rehabilitation facilities qualify for CMS certification? And the answer is yes. There are 3 different types of organizations that may qualify as providers of outpatient physical therapy and speech language pathology services. Clinics, public health clinics, and rehabilitation agencies are the 3 different organizations. However, rehabilitation agencies are the only organization that are currently enrolled as a Medicare provider with a CMS certification number. Conditions of participation for CMS are different for an inpatient rehab facility than it is for an outpatient rehab facility. A rehab facility can provide both inpatient and outpatient services for patients if they are both licensed by the state and certified by CMS to do both. They provide an intensive rehabilitation program, and patients who are admitted must be able to tolerate 3 hours of intense rehabilitation services per day. CMS collects patient assessment data only on Medicare Part A fee-for-service patients. Next slide, please. And the next question that we were presented with was, how does one qualify for a CMS certification? And CMS is a division that the facility would need to apply for. And once applied for, they would then have to complete a state survey by surveyors who have been designed in that capacity to fulfill this certification. If all their requirements are met for CMS certification, they will then be granted CMS certification. The facility will be granted CMS certification, and then they will have to go through, make sure that they're continually educating their staff to continue their requirements for CMS.
Okay, hey guys, so I want to talk about the accrediting body for the rehab facilities. The name of this accrediting body is CARF, which stands for Commission on Accreditation of Rehabilitation Facilities. This was formed in 1966 by merging 2 national organizations, and these 2 that merged are the Association of Rehabilitation Centers and the National Association of Sheltered Workshops and Homebound Programs. Next slide, please. When researching CARF, I used the website carf.org, and I went through the different accomplishments that CARF has gotten. So this slide is just a few of the many accomplishments of CARF. I just wanted to highlight a few for you. So in September, CARF was created, and I wanted to point out that it's international. They are involved in many other parts of the world than just the United States. They are also in Canada, Europe, South America, Oceania, the Middle East, Asia, and Africa. So now on to some of the highlights. They were created in September 1966, and in April of 1970, Council of State Administrators of Vocational Rehabilitation passed a resolution that urged states to have their rehabilitation facilities certified by CARF. They had many different presidents recognize the organization. In September 1976, they were recognized by President Ford. In May 1979, they were recognized by President Carter. In April 1981, they were recognized by President Reagan. And in August 1991, they were recognized by President Bush. In January 1996, CARF published the first edition of the Accreditation Sourcebook, which has been edited many times by now. In January 2005, CARF came out with many different accrediting manuals for children. Now, in 2007, they had many different milestones, but one of the major accomplishments was that the company came up with many new standards for the different departments that they accredit. This company is always creating new standards to make healthcare better. Next slide, please. Now we're going to talk a little bit about how Medicare reimburses for rehab facilities. I found all my information on cms.org. Medicare pays for the outpatient therapy according to the set fees that were established by the physician. All are sent to CMS using the Healthcare Common Procedure Coding System. They will pay for therapy services by physical therapists, occupational therapists, speech-language pathologists, and physicians. However, they will not pay for athletic trainers, chiropractors, and nurses because they are not qualified to bill Medicare for such services. The last thing I want to mention that isn't in the slide is the 100-day period for the long-term patients. Medicare will pay a predetermined daily rate, but only up to 100 days, and they will pay this after a qualified hospital stay of at least 3 days. And that is the basics of how Medicare reimburses rehab facilities. Next slide, please.
Okay, so we have Medicaid's role in reimbursement for rehabilitation facilities. So I wanted to go through and just kind of talk about what Medicaid is. Medicaid program is a jointly funded by the federal government and states to provide health coverage for low-income adults, children, pregnant women, elderly, and people with disabilities. So it's pretty broad. So I went to Medicaid.gov and looked up inpatient, the financing and the reimbursement section, and it talks about kind of the process and how they do this. And this is the federal government pays states for a specified percentage of program expenditures called the FMAP. The FMAP varies from state to state and is adjusted for each state on a 3-year cycle to adjust for fluctuations in the economy. Each state must ensure that they can fund their share of Medicaid expenditures for the care and services under their state plan. They must also verify they can meet regulations so they can authorize FFP for covered services. So we're learning that there's this like methodology and how they are going to pay and how everything works. So if you go to provider payment rates, it says states establish their own Medicaid provider payment rates within federal requirements. States generally pay for services through fee-for-service or managed care arrangements. So under fee-for-service, which is FFS, states pay providers directly for services. States develop their rates based on the cost of providing the service, a review of what commercial payers pay in the private market, and a percentage of what Medicare pays for equivalent services. And then there's managed care, which is states contract with organizations to deliver care through networks and pay providers. Approximately 70% of Medicaid enrollees are served through managed care delivery systems where providers are paid on a monthly capitation payment rate. If you go to the next slide. I just wanted to go over what capitation payment rates are. It's a fixed amount of money per patient per unit of time paid in advance to the physician for the delivery of healthcare services. Next slide. So I found out some other things that to do depending on the state. Rates can also include incentive payments that encourage providers to serve Medicaid populations and improve care. Because it is on a state basis, if you go to each state's website, you can look up the fee schedules and you can look up the payment options because each state's going to cover something different. Online fee schedules identifies covered and non-covered procedure codes, restrictions, and allowed units, and the Medicaid allowable fee per unit. I also did find out that they can cross over, so there's crossover plans with Medicare. So they can combine what Medicare doesn't cover, Medicaid can cover, it just depends on the situation. There's also the ability for direct deposit options, and they're made available to the providers to have their Medicaid checks automatically deposited into their checking or savings account. Next slide. So this one is local rehabilitation facilities. I live in St. Louis, so I kind of took 3 that are pretty big in the area. And the first one is called Tristel, which is the Rehabilitation Institute of St. Louis. It's an inpatient rehabilitation and an outpatient rehabilitation services, and it's freestanding. They are joint committed or certified, and they are also with CARF, certification in stroke rehabilitation and hip fracture rehabilitation. There is the Missouri Baptist Medical Center Outpatient Center in Sunset Hills. They have outpatient rehabilitation, and they're located within an acute care hospital. They are accredited, and they have been on HealthGrade's Top 100. Then there is SSM Rehabilitation Hospitals, and they are located, there's a few different places. There's Richmond Heights, St. Charles, which are located in the acute care hospital, and then there's Bridgeton, which is a freestanding. They offer outpatient and inpatient rehabilitation services. They are joint commissioned, and they are certified in primary stroke center accredited and chest pain center with PCI. Next slide. So I also have the great honor to interview Tara Debling. She is the Chief Executive Officer of the Rehabilitation Institute of St. Louis. And just to tell you, the Rehabilitation Institute of St. Louis is a joint venture with BJC Healthcare and Health South. She was way excited that we were studying about Health South. So I just wanted to give you some education, her little background, and in 2000, she got her BS in accounting and graduated from Southern Illinois University. In her first experience from 99 to 2000, she was the Director of Rehab Care, which is inpatient services. From 2000 to 2010, she worked as the CFOO at Healthcare Unlimited. And then from 2010 to present, she's worked her way up. So she started off as the controller to the COO to now the CEO. Next slide. So I asked her about some of the challenges and opportunities of managing a rehabilitation center. And she went through some, and she said the top one would be patient and family education. And this is really understanding what inpatient means, to really educate the patient and the families. What services are offered, what staff is going to be available, what type of intensive services that they're about to experience. And the second part would be prevention and treatment. And this is, your post-care. What are your signs and your symptoms? What got you here, and how to prevent you from happening again, and how to take care of yourself once you leave. Then there's availability of financial resources. So it's educating them on the people that are uninsured, that are underinsured, what's available. They do percentages based on your income level, that they'll do a lot of discounts for their services. They're very different because if you don't have insurance, they still will take you. There is availability of outpatient resources, and this means just really connecting with them and helping them to remain, more independent once they leave, educating them on what's out there. Another challenge is forward-thinking providers. And this is, the type of rehabilitation facility to benefit patients. And that's determining the best post-care destination for the patient. It's getting the providers to think, where do they need to be? Do they need to be in inpatient rehab, long-term acute care, skilled nursing, or outpatient services? What does each rehab specialize in, and what's the best place for that patient to be? The next is discharge, and that is community resources availability so that the patients can grow to progress towards their goal and be independent. And then there's long-term versus short-term needs. And she said, this is a challenge because you have sometimes just a short amount of time, and it's really, you're trying to help provide long-term needs in a short amount of time frame. The next one would be some of the opportunities. And along with, even though education is a challenge, it's also an opportunity. So she said it's being an opportunity as a manager is to be a problem solver. How can you fix the challenges, and how can you make your facility stand out among the rest? And that is through social economics. It's understanding your market, know your patients' cultural backgrounds, know the population in your area, the health rates, household income, and the location. It's knowing the people that you serve and understanding their needs. And another opportunity, again, is about educating your staff and patients, showing how to ensure a better outcome for their situation. And one of their goals with Tristel is patient-focused and results-driven rehabilitation. And I think that she said that's just a key thing. We really want the best long-term outcome for our patients. Next slide.
I'm not sure whose slide this was, but I can read it.
I think it's Kellie's, and I think she was having problems getting on. She just put I am here, and I emailed her to see if she could join the video, but she hasn't emailed me back.
Okay, I can just read it. Rehabilitation facilities are usually owned or managed by a corporation. I think the next one is hers as well, correct?
I'm sorry, I think so.
Okay. Health South is the nation's largest providers of post-acute healthcare services, industry leader in home-based patient care, and their priority is to deliver high-quality patient care, and our team of experts has extensive experience in today's most advanced therapeutic methods and technologies. Health South uses a unique intensive approach to rehabilitation, and they're founded in Birmingham, Alabama is their headquarters, but they're pretty big throughout the nation, I believe. And then, is there a national advocacy organization for rehabilitation facilities? Yes, the American Hospital Association has a segment of their efforts going towards rehabilitation facilities. This section seeks to improve continuity of care between acute, pre- and post-acute, and long-term services, and to support efforts to improve delivery of health-related services to chronically ill, elderly, and disabled persons requiring continuing care in institutions, the community, and the home. They represent over 3,300 facilities, and their members have valuable opportunities to network through a variety of meetings and conference calls on specific issues and topics. A wide range of association resources are available to support health reform activities and performance improvement. And there's that website there at the bottom where you can go and become a member and find out all of the actions that they are doing for rehabilitation facilities. And I think that's it.
Well, you did a wonderful job, the whole group. So I don't know what you were worried about when we were talking before we started. So excellent job. You really covered everything. I just want to highlight some of the things you covered just to help people focus a little bit. So you did a great job in showing that Some rehab facilities are inpatient only, some can be outpatient only, and some can be both, right? And so you covered that. Just keep that in mind, is that not everything is an inpatient, not everything is an outpatient facility, and many times these rehab facilities often are licensed and certified in a way to serve both populations. You know, a common example, I think, for inpatient rehab is probably stroke. You know, if a patient has a stroke, they get stabilized in an acute care hospital, and now they just need some really intensive rehab. You know, their speech, their motor movement again. Those types of things can be done in a rehab facility. You also mentioned the difference, you highlighted some of the accreditation groups, and that was great. And I just wanted to highlight that, keep in mind, just like when we learned in 285, where hospitals can be accredited like by Joint Commission, but they're also licensed by the state, and you guys mentioned that keep in mind that when it comes to licenses for rehab facilities, the licensing is still done by the state, and you guys did a great job in mentioning that, and then also highlighting how the accreditation and certifications may be done by different bodies. But don't let those terms confuse you. Keep them clear in your mind. License is different than accreditation and certification, and licenses are done by the state. You also talked about the Medicare payment and the 100 days post-acute episode. That's an important concept to keep in mind. And then the 4 types of kind of therapists, or the types of therapy. You highlighted occupational, physical therapy, speech language, and then there's respiratory therapy as well. And then the last, I'm glad you had the slides on Health South. They are the largest, as you mentioned, and they're also, even if you just look at inpatient rehab facilities, they are also the largest just for that kind of subsection. On a side note, you guys are all probably too young, but do you guys remember a major health scandal with Health South a while back? Does anyone, or did you maybe come across that at all?
No, I don't remember.
I don't remember seeing anything.
So, and you guys probably haven't had HS 345 yet, which is the healthcare finance class, but Health South is a corporation, and they had shareholders, right? And so they, no different than Boeing or Dell Computer, all these different corporations that have to report numbers to Wall Street and report that they have earnings, you know, for each share of stock. Well, they got into some pretty deep water. CEO and some of the high-level executives were put in jail, and it was mainly because they kept kind of cooking the books a little bit, showing that in the accounting records that they were doing better than they really were, and that got them into a lot of trouble. It was a big kind of scandal. If you're interested, you could look that up, but that's not something you have to know for the class. I just thought I'd mention it. You'll probably come across that as you move forward in the program. So excellent job. Any last minute comments or questions before I let you go?
No.
Thank you. If you would post the slides, I'll post the recording a little later once it processes. So post the slides. There's that student chat board.
No have fun with Tyler.
Okay, and then kind of monitor that and just see if there's people have questions or comments,
Okay.
and just monitor the board. And I hope you all have a wonderful Thanksgiving.
You too.
You too.
Have a good night.
All right. Thanks.
Bye-bye.